Hi, I'm Dr. Haque. If you have diabetes, your doctor will evaluate and monitor your condition by certain measurements. This video will help you understand these numbers, what they mean, and what you can do to improve them. Let's start with the basics. Diabetes is a chronic disease in which blood glucose levels are high. In order to understand why glucose levels are high in diabetes, it's important to understand what happens to glucose in a normal person. Carbohydrates or starches are the main source of energy for most people. When we eat food, the carbohydrates are broken down in the intestines into single units called glucose or sugar. Glucose is absorbed into the intestines and travels to the blood and enters the end organ. Now, each organ of your body, such as the heart, the brain, the muscles, they require glucose for energy. In order for these cells to extract energy from glucose, the glucose has to enter the cells. And that entry is dependent on this hormone called insulin, made by your pancreas. When you eat food, the body makes insulin. The insulin then allows these cells to absorb the glucose inside, and then the glucose is used to get energy for the cells to function. In diabetes, this entry of glucose into the cell is defective or absent, depending on the kind of diabetes you have. So in type 1 diabetes, the body, the pancreas, do not produce insulin because by mistake the immune system damages the insulin producing cells. This is called an autoimmune process. In the absence of insulin, the glucose is unable to enter the cells, and this leads to high levels of glucose in the blood. In the other kind of diabetes, which is more common, type 2 diabetes, the insulin is produced by the pancreas, but the body or the cells do not respond to insulin because of defective interaction between the insulin and the receptors on the cells. The end result is the same. The glucose cannot enter the cells, and therefore the blood glucose levels become elevated or high. Type 2 diabetes over time can change in the sense that in the early period the body is able to make insulin, and therefore it may be easier to control diabetes, but with time it may become more difficult because the insulin production by your pancreas decreases over time. These numbers are very important in diabetes because most patients with diabetes do not have symptoms unless the glucose levels are very high or if they have already developed or are developing complications. The commonest way for patients to monitor their glucose is through glucometers. Glucometers are handheld, portable devices that allow you to monitor blood glucose at home or at work. They usually come with the lancing device and lancets. Essentially, these are tiny needles that can be used to get a tiny amount of blood from the fingertips. The blood is applied to a small test strip which is inserted into the mirror, and the glucose results are displayed within a short period. Depending on your diabetes, your doctor may ask you to check glucose readings once a day or once a week or twice a day. Your doctor may ask you to check glucose readings in the morning before you've eaten, or sometimes he may ask you to check your glucose readings after meals. In general, if you're asked to get glucose readings after meal, the best time to check it is 2 hours after a meal. The target for patients with diabetes is to keep glucose readings in the morning, which are called fasting glucose, between 80 and 120 milligrams per deciliter. And if your glucose readings are well controlled and your treatment is working, the 2-hour after meal glucose number should be less than 160 or 180 milligrams per deciliter. A more recent advance is something called continuous glucose monitoring, or CGMS. CGMS automatically tracks blood glucose levels throughout the day and night. It works through a tiny sensor which is inserted under your skin, usually under the arm or the belly. A transmitter will send information to your cell phone or a monitor device that you may get with the CGM system. CGMS is always on and checking glucose readings as you are showering, you're working, exercising, or sleeping. This will allow you and your doctor to notice the effect of your meals, your exercise, or your medications on glucose values. You can set alarms with low or high blood glucose readings in case you are prone to unpredictable glucose swings. Now, this is a lot of information, so it is useful in people with more advanced diabetes, but we've noticed that the information can be used as behavioral modification tool for patients with milder diabetes. And in general, when patients are using these advanced systems, their hemoglobin A1C levels or glucose levels are usually 0.5 to 1% lower than otherwise. The next measure that most of you probably already know is a blood test called hemoglobin A1C. Hemoglobin A1C is a simple and common blood test which tells your doctor what your average glucose readings have been over the last 3 months. How does it do that? Well, when your glucose or sugar enter the bloodstream, it attaches to a protein in your red blood cells called the hemoglobin. Everybody has some sugar attached to their hemoglobin, but people with higher glucose levels have more of it attached. And because red cells live in your bloodstream for 3 months, by measuring the amount of sugar attached to the red blood cell, you can get an idea or an estimate of your average glucose reading over the last 3 months. So what are these numbers? What is normal and what's abnormal? In patients who don't have diabetes, this hemoglobin A1C number should be less than 5.5. If you have a hemoglobin A1C level of between 5.6 and 6.5, you have what we call pre-diabetes, or stage before type 2 diabetes have developed. And if you have diabetes, this number is 6.5 or above. If you already have diabetes and are on treatment, your doctor will want this hemoglobin A1C number to be less than 7. The target hemoglobin A1C can be a little different depending on your individual circumstances. And in some people, this number should be less than 6.5. In this slide, you can see what different hemoglobin A1C levels mean in terms of average glucose readings. So a value of 7% would give you an average glucose reading of 150 milligrams per deciliter. Please note that this is an average. So this is an average of glucose readings in the morning, before eating, and after meals. In general, if the hemoglobin A1C levels are above 8 or 9, the risk of complications from diabetes is really high. What are these complications? Diabetes, if not controlled, can increase the risk of cardiovascular disease like heart attacks or strokes. And it is the uncontrolled diabetes is the leading cause for advanced kidney disease or dialysis requirement, as well as blindness and amputations of lower extremities. We will discuss these in a separate video, but the idea was if your numbers are not right, you are prone to these complications. And this slide is from a big trial. You can see hemoglobin A1C levels, if they are near 6, 6.5, the risk of complications are very low. And if the levels are above 7, the risk goes up. But it particularly becomes more steep if the hemoglobin A1C levels are above 8.5 or 9. If you have diabetes, it's important for you to know, particularly if you have type 2 diabetes, that the glucose abnormalities may not be the only problem that you may face. Oftentimes, patients who have type 2 diabetes also have high blood pressure or high cholesterol or another lipid or fat in the body called triglycerides. They could be high. So in terms of numbers that you and your doctors should concentrate on, include the glucose and A1C values that we discussed, but also blood pressure and cholesterol numbers, and we'll review them in the next few slides. So this slide explains those three abnormalities that patients with type 2 diabetes deal with and what those numbers should be in terms of glucose reading, blood pressure reading, and cholesterol readings. Patients who have diabetes have high risk of heart disease, and therefore a cholesterol value that is otherwise normal for a non-diabetic patient may be abnormal. And in general, your doctor would want your cholesterol levels to be controlled aggressively and may recommend you taking statins, which are medications for cholesterol. So LDL cholesterol, which is called the bad cholesterol as well, should be lowered to below 100 milligrams per deciliter in patients with diabetes. And if you have diabetes and already have heart disease, or if you smoke or have other risk factors for heart disease, your doctor may want this LDL cholesterol number to be below 70 milligrams per deciliter. And that's because when you have multiple risk factors for heart disease in the presence of diabetes, cholesterol becomes more sticky and can cause plaque buildup more easily. So a typical patient who has diabetes would see their doctor every 3 months. Your doctor will check your blood pressure, examine you, order this test called A1C, and measure your weight. If your diabetes is well controlled, he may want to check you every 6 months and ask you to see a dentist. Depending on your blood pressure and your cholesterol values, the doctor may want to check that every 6 to 12 months as well. And once a year, your doctor will perform a more thorough physical examination, particularly a careful examination of your feet. And that's because diabetes, when not controlled, can cause neuropathy, which can lead to amputations. You should have an eye exam. You should make sure your flu shot is updated, and your doctor will check kidney and liver function at least once a year. So in conclusion, because diabetes does not cause symptoms, monitoring diabetes involves measuring these numbers that we discussed. The most important numbers for you to remember are the A1C, which is average glucose reading, blood pressure, and cholesterol or triglyceride numbers. If these numbers are well controlled, you can prevent complications of diabetes and lead a healthy life. Thank you.
This video is for informational purpose only and is not intended to serve as a substitute for consultation and medical treatment. Please contact your healthcare provider about any questions pertaining to your specific condition. They will be able to provide you with answers and recommendations that are specific and accurate for you. Good luck and thank you.